Incidence and prevalence are epidemiological measures that describe a disease in terms of how many new cases occur and how common it is in the population. Commercially, they are important figures because they are used to predict the sales potential of an intervention. They are also widely used in other areas, for example, when demonstrating the burden of a disease or when estimating the economic impact of an intervention. Let us now examine these concepts in more detail. At any point in time, in a specified population, for example, a country, there will be a number of people with the disease. As time passes, some people will enter the disease population as they develop the disease, while others will leave the disease population as they recover, are cured, or die. The incidence of the disease is the number of new cases arising in a given period of time, for example, a year. The prevalence of the disease is the number of people living with it at a given point in time. This is linked to incidence, but is also affected by the duration of time people have the disease. Diseases that arise frequently have high incidence, but prevalence may still be low if patients quickly recover or die. Conversely, diseases that arise infrequently have low incidence, but may still have high prevalence if patients are affected for a long period of time. The incidence over a given time period can either be expressed in absolute terms, as the number of new cases, or as a rate, for example, the number of new cases per 100,000 people, or the percentage of the population affected. Similarly, the prevalence at a given point in time may be the absolute number of people living with the disease, or the prevalence rate, for example, the number of cases per 100,000 people, or the percentage of the population affected. In their simplest forms, incidence and prevalence rates may be calculated from the absolute figures in the given population. These are known as crude rates. However, when making comparisons between populations, crude rates may be misleading because the population demographics may be different. For example, in a population with a relatively large proportion of older people, there are more people at risk of developing an age-related disease. Even if the risk of each older person developing the disease is the same, the number of cases will be higher than in a relatively young population, so the incidence and prevalence will appear higher. Age standardization adjusts the rate to what it would be if the population had a standard age structure, allowing comparison between populations. The most frequently used structure is the world standard population, which generates world standardized rates. Consider France and Italy as an example. Crude cancer incidence rates are higher in Italy, but age standardization indicates that this is due to a relatively older population in Italy. In fact, the age standardized incidence rate is higher in France. Let's now look at how incidence and prevalence can be used in forecasting sales potential. In this simple example, the disease has a duration of 2 years. Patients are treated with a short period of acute, aggressive treatment followed by maintenance therapy for the remaining duration of the disease. In a defined population, 2 new cases of the disease arise each year. The incidence is therefore 2 cases per year, and the prevalence within the population is 4 cases. To estimate the patient pool for an acute intervention, the disease incidence is the best approximation because patients receive acute treatment immediately after diagnosis for a short period only. Prevalence would overestimate this patient pool because patients need maintenance treatment rather than acute treatment most of the time. Conversely, prevalence is the best approximation for the maintenance treatment patient pool. Of course, this is a very simplified example, but the principles illustrated apply to real-life situations with large numbers of cases arising at various times throughout the year and lasting for various lengths of time. In this video, we have covered epidemiological terms, incidence and prevalence, including how they are expressed and they use in sales forecasting.